Welcome, everyone, to the Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy counselor, and I'm joined today with Dr. Jason Martin. He's a board-certified plastic and reconstructive surgeon. How you doing, Dr. Martin?
Doing pretty good. How you doing, Amy?
I'm doing a lot better now that I can see you through your glasses. They were as dirty as I've ever seen them today.
That's the way I roll.
It was today.
Dirty glasses.
Dirty glasses. So I appreciate, though, that you told me it was my job to keep glasses clean.
It is absolutely your job.
I think that's probably true.
Yeah. As embarrassing as it sounds when I say that.
No, I think it's, I mean, that's...
Sometimes you got to do the hard job.
Making sure you can see, I mean, that benefits everyone.
Yeah. So what are we talking about today?
Today we have a topic that was actually a viewer of ours on YouTube. So if you don't follow our YouTube channel, or if you want to watch this podcast, you can follow us at Jason Martin MD on YouTube and at Beauty and the Surgeon podcast on Instagram. A woman recently reached out to us on our podcast episode about breast reduction and had some questions about if it was similar to a breast lift. And she asked if we had an episode about breast lift.
Which we didn't.
Which was surprising to me. I'm like,
how is that even possible?
Well, we've talked about it so much in Mommy Makeover. We talked about it in answering the question from Tiffany from Ohio. So we've talked about it a lot, but we've never dedicated a whole episode to it.
I mean, it's going to keep going like this because we always think that we've reached the end of the road with plastic surgery procedures, and another one pops up from the viewers and listeners.
We're talking today about the technical term for this surgery is called mastopexy. Mastopexy, or breast lift, as it's commonly known, and that's what we're talking about today.
I mean, sagging breasts are a problem, right? We see it all the time in clinic.
I would say they're common. I wouldn't say they're a problem.
Oh, here we go. Okay. They are common in our clinic, and people come and say they would prefer not to have saggy breasts. Is that a better way to say it?
It is.
There we go. Okay, good. How common is breast lift surgery, Amy?
So we have a slide up that's talking about the commonality of breast lift surgery. The statistics from the American Society of Plastic Surgeons was this 2000... Since 2000.
It's grown.
So it's grown 70% since we started tracking in 2000. So in the last, 20 years.
It's actually made the biggest jump, I think, of all the surgeries we do.
Yeah.
And I was thinking about that. So I think that historically it's always been breast augmentation, but I think more women are choosing just a breast lift alone versus a breast augmentation.
Well, and women who had a breast augmentation in 2000 definitely need a breast lift in 2020.
So it's probably two roads lead to the same point.
Yeah. It's a problem of aging. I think it's the same reason why we see with these patterns in plastic surgery, we look at them, how some surgeries will come and go. I think that just shows the age of the population, perhaps, or the fact that, breast augmentation with silicone breast implants, they came back on the market in 2007. So on average, people are going to have another breast surgery in 10 years. And one of those surgeries that you may want on your breast is a lift.
Yep.
Yeah.
2018 stats, it showed a big jump. Breast augmentation numbers went down. Liposuction was number 2. If you can look on our YouTube channel, Jason Martin MD, you can see this. The liposuction numbers went down. That was number 2 of all procedures we do in cosmetic surgery from board-certified plastic surgeons. Number 3 was breast lift, and that was actually increasing the number of cases. So very popular on the street. I have my ear to the street, Amy, and I know what the people want. You may not. You may not have your ear to the street, but I do.
I do.
I don't think you do.
I do.
I'm at the coffee shops. I'm at Target. I'm at different places where, the women are. And I just ask random women, like, what are you thinking right now? What procedure would you want?
I guarantee that there is a song about this problem that I am the only one in this room that knows.
Like a recent song?
No. It's like a parody, perhaps.
Oh, yeah. Yeah, I know that one.
Mm-hmm.
Yeah, I do.
You do?
It's very inappropriate.
It's not that. I don't know.
It's like one of those army songs, right? Do your blank blank,
yeah, hang low.
Yeah, everyone knows that.
Can you throw them over your shoulder?
Not.
See? So
you are not that special. Come on.
I do have this body part though, so that puts me at least a little bit as a little.
I have one too. No. No. Hand off the computer. Men have breasts too.
They do, but do they really?
Hence, please go back and listen to our gynecomastia episode where we talk about male breast.
Have we ever done a male breast lift?
No, but we've done gynecomastia surgery, which is a reduction.
And we have had a patient that we thought we might need to do a breast lift on.
Yep.
So I guess that's true.
I mean, it's possible.
Yeah. You guys are so worried about scars though, so,
This is not going the way I thought it would go. Anyways, so breast lift surgery is very, very common. For all of you out there who have sagging of your breast and you'd like to have more youthful appearance to your breasts, breast lift surgery is a great option. Amy, let's talk about what makes up a breast. If you listen to our breast reduction episode, this is kind of, we had a similar discussion, but you can go through it quickly again for those who didn't listen to that. What really does make up the breast? What's the anatomy of the breast?
So it's primarily fat, mammary ducts. Those are the two main things that make up the bulk of the breast. And we talked a lot in our breast reduction episode about the ligaments. Oh, and I'm going to forget the name again. Cooper's ligaments. The ligaments.
Dr. Cooper is really not happy with you.
I know. He's like, I'm so important. The ligaments that hold the breast up. And the same dynamic happens with aging or changes throughout life, like breastfeeding or even just pregnancy. Even if you don't breastfeed, like those ligaments stretch and they don't always go back. So those things contribute, just that, and then the weight of the breast itself and skin changes, all those things contribute to the sagginess of a breast.
Right, and then we gain weight with age. The breasts tend to get larger in most cases, and the larger they get, the skin gets saggier, they get heavier, and then you have this problem. It's a pretty common problem, especially after pregnancies.
Yeah.
So why do breasts sag, Amy? So you're the expert because you're a woman, apparently.
Mm-hmm.
And,
apparently.
Yeah.
I think that's pretty apparent.
Okay. Why do breasts sag? What are the reasons?
So most of the reasons we just discussed, I mean, the descent and like loss of tensile strength in those tendons and ligaments and the soft tissue that support the breast, which is why even a woman who has very small breasts, like an A cup or even smaller in some cases, can still have a lot of descent of the breast itself. So the nipple and areola can still descend, even though there may not be a lot of weight behind it. So it's not just a weight or a weight of the breast issue or even a weight fluctuation issue. Like just gravity is pulling down and you're losing some of that tensile strength of those tissues. Obviously, breastfeeding is going to add to that. Weight fluctuations through pregnancy, through just life, general aging.
So with aging, we've talked about this many times before, your skin thins. Mm-hmm. The dermis, or the deep layer of your skin, gets thinner, right, because you have less collagen. As Amy said, gravity and heredity, too. I mean, you see this running in families. I mean, certain genetics, people, especially women who maybe in their families, almost all the women in their families, after pregnancy, they had this problem. Their body physiology or anatomy is not able to withstand the fluctuations with pregnancy. So you see that running family lines. I mean, those are the main reasons. With age, things sag. That's the reason we have an office.
Yeah.
So, and breasts is probably one of the more notable ones that does sag. There's different ways to look at the breast with the sagging, and we graded out different levels of what we call ptosis or sagginess. And, and it depends if you're considering the surgery, if you're coming into the office, it depends on the severity of what you have, what we're going to do. And that's really, it's not so straightforward, right? Because sometimes you can just do a lift. Sometimes you would do a lift with an augmentation or a breast augmentation. Sometimes you would do a reduction with a lift. So it gets a little bit confusing, but it really just depends on your presentation. You agree with that?
I do.
Good. All right. Before surgery, you came into our office, your breasts are sagging and you want an improvement, okay? And you're a candidate. So what are some of the things they're going to need to do before surgery?
So the main things we want to make sure is that you are healthy, and those things include, but are not limited to, being at a healthy weight, having a recent mammogram. If you are over the age of 40, it is recommended that you have a mammogram on file that's clear. If you're under that age, which a lot of women who are getting a breast lift are in their early to mid 30s, that may not be a requirement, but certainly if you have a family history of any type of breast-related issues, we probably would insist that even if you're young, you get a mammogram. We don't want you to be smoking. That's for any surgery, but specifically surgeries that are incisional surgeries, meaning there is a incision of any length. It's really important that heals, and especially when you're dealing with blood supply to your nipple and areola. That's pretty important to most women, pretty important to most men. So you want to make sure
that seems to be like people that do smoke. And I always feel like people that smoke should know that their blood supply and the soft tissue is decreased when they smoke, but that's not a common. People don't understand that.
No, they don't. Nope.
The smokers. So yeah, definitely smoking and diabetes, two of the things that really inhibit wound healing. Mm-hmm. And you do not want to go into an elective surgery where you don't heal right. And smoking it is, at least in our office, you have to stop smoking at least 4 weeks beforehand, definitively. There's no way around that. So.
Yeah, it's elective surgery. Why take an unnecessary risk with an elective surgery? It's just not worth it.
Right.
Yeah. The other main thing, too, is making sure that you plan adequately for recovery. And we do have a couple of podcasts where we talk about recovery. If you're considering a breast lift, the one where we talked to Tiffany is a great one because those were some of her questions, and we'll cover some of that in this one as well. But you can't go back. So making sure that you're prepared.
Are you talking about Tiffany
advance.
from Ohio?
I am.
Oh, yeah.
Yeah.
Shout out to Tiffany from Ohio.
So
I
have
remember that episode.
Right. So it really is important. Like you get one chance to make your recovery as ideal as possible. So preparing in advance.
Like
is
that
helpful.
Eminem song, you got one chance. Mom spaghetti.
Yes, exactly like that.
Okay.
Yes.
Well, real quick on this, the medications, we've talked about that before. There's certain medications that inhibit healing, increase bruising, increase bleeding. You should definitely listen to our episode that Amy did where she talked about supplementation in the postoperative recovery phase. And these are things that would be really helpful for moving through this type of surgery. So, and healthy weight. Yep. All right, Amy. So let's role play. Okay, you're a patient, right? What's the best way that I can tell you the different types of surgeries we do without being doctory and making it confusing?
I'm probably not the one to ask that because I've been at this for a while.
I know. I'm afraid if I explain it, it's just going to go into some mushy mush like medical conversation.
No, I don't think it does. I mean,
Okay.
you explain this to everyday people every day as well. So I think you explain it in a way that makes sense.
But it's easier because I can like point at stuff.
It is. And being able to show someone, is really great. If you don't want to watch this podcast on YouTube, you can certainly look up pictures of mastopexy
Yeah, I guess that's true.
incisions.
So YouTube is helpful at this point.
Yeah, just to visualize it. But I think most people can visualize pretty well. The two main types of mastopexies that we do anymore are going to be a lollipop
Yep.
or a periareolar mastopexy. So those are the two really common ones. It's less likely that we need to do an anchor with a straight mastopexy. Those are more common if someone is also doing somewhat of a reduction. Then it's more common, or if you've had a previous mastopexy where they did do an anchor, we might just use those incisions again because they're already there. So those are the three main types, but the first two being the most common. And for us in our office, it's really a lollipop is the most common type of mastopexy we do.
That would be the high majority.
Yeah, which involves an incision completely around the areola and then straight down from the base of the areola to the base of the breast.
Because in this situation, when you have saggy breasts, one of the main issues usually is the nipple and areola location. It's usually below your fold. If you take a finger and put it on your inframammary fold or the crease where your breast attaches to your chest wall, and take your thumb and press down right on top of your finger, your nipple and areola should be at that level or above. And if it's below that, then you know you need to lift the nipple and areola. So most people come in, they're like, my nipple and areola is not in the right place. Of course, that's a big part of a breast lifting surgery, but also the things you see with this, especially with age or after pregnancy, is all the stuff of the breast it descends, it goes down. And so you're going to move that back up into its normal position. So the nipple and areola location needs to usually, in almost all cases, go up. And then the breast tissue needs to be rotated back up to its normal position. The periareolar, which is the incision only around the areola, is in cases where the nipple and areola doesn't really have to go up much.
Which is rare.
Yeah.
It really is.
There's something called pseudotosis where you don't really have the nipple and areola is in a good location, but the breast parenchyma or the breast tissue is descended and looks saggy. So in that case, you could do a periareolar.
Yeah, more like if you just kind of tighten up the breast. In those cases, it would be even more rare that we would do that without a breast implant. So that type of, I feel like those types of mastopexies are more about tightening the breast a bit versus lifting it as much.
Yeah.
They're more about bringing the breast.
Yeah, you're not getting as much of a lift.
Yeah, it's more of a tightening. Like, so giving you that more youthful appearance by making the breast overall just kind of tighter and more toned looking. It does lift it slightly, but it's not really putting things back in place like it does with what Dr. Barton was just describing with kind of putting that tissue back up as well.
Yeah, and the lollipop tends to heal really well.
Mm-hmm.
We have pictures on our website, jasonmartinmd.com. You can see what a lollipop looks like. And that's, probably the biggest concern, I'm sure we'll talk about this more, for women undergoing this procedure is the scars. So is it worth it to put scars on your breast to lift your breast at the same time? With breast reduction, the scars seem to be worth it because people functionally feel better. Mm-hmm. But with a breast lift, it's an aesthetic thing for most cases. And some sometimes women just really just don't like the feeling of their breast hanging down. It just doesn't feel right.
Right. Or they want to not wear a bra.
Not wear a bra.
Yeah.
That's a big one too. Yeah,
Yeah.
exactly. So, improving that does, from just a self-perception standpoint, improve a lot of things. But the fact that you have scars in your breast is kind of a trade-off.
Mm-hmm. It is. Yep.
But the lollipop tends to, I mean, at least in our hands, tends to heal really well.
It does. I mean, there have been rare cases where we've had patients who it has spread, or just not healed as well.
Not normal appearing
Yeah,
scar.
very, very rarely.
Yeah.
Yep.
In those cases that I can remember, we were able to fix it in the office, and it was totally fine.
Yep. Yeah, revision does help. Yeah. So, are we good?
Yeah.
You built. Sorry, there's some confusion. Dr. Barton built these slides this time, and I'm not entirely sure what's coming next. Kind of like a surprise podcast. I'm like, ooh, what's next?
Yeah, what is next?
Like I kind of like, yeah.
Wait! Don't press the button. This is guess what's now. You saw it before.
I saw it. It's like the monster at the end of the storybook. Like what's
no?
on
I
the
mean,
next
so
page?
the surgery itself takes. Let's just go through that real quick. It takes about about 2.5 hours for me, Amy? At the most?
I usually book it for 3. But
Yeah.
there's just and some of that, as with all surgeries, and this is what I usually explain to patients, is the OR time that I schedule is not necessarily your hands-on time. There's a lot of things that happen during surgery.
We have a good episode on who's in the OR.
Who are the people in your
Describes
OR?
that.
Yeah. So especially with breast surgeries, Dr. Martin is extremely, extremely OCD about sterility, and he changes his gloves about 1,000 times, which
Don't give away my secrets.
No, I mean, this is a good secret, but because we are dealing with breast tissue and milk ducts, and it kind of is a two-way street with your nipples, the stuff can get in. So we're very, very hyper aware of making sure that it's extremely sterile, that everything is done just right. So there's OR time that you're in the OR that's not active hands-on time. So Dr. Martin's going to say to you like, oh, this will take me 2 hours. And then Amy schedules you for 3.5 or 4. And you're like, Dr. Martin says it's going to take 2 hours. So
It takes me 2 hours.
takes him 2 hours.
In my world, it matters how much time it
Yes.
takes me, and then everything else just happens around me, apparently, like cleaning my glasses.
It's around
You
me
had to divulge that
in the
information.
sphere.
So it's about 2 to 2.5 hours. One of the things about the surgery, if someone's interested in the surgery and they want to do their research, there's different ways to maintain the nipple and areola, and that's called a pedicle, P-E-D-I-C-L-E. If you look that up, there's different types of pedicles. There's inferior based or below, superior or above, and what I use is a superior medial pedicle, and that tends to work out really well, or a superior pedicle. And then another thing I do with mastopexies is I use the breast tissue, which is fat, and breast parenchyma, which is like the ducts, the things that make up breast that aren't fat. And I actually use that tissue and rotate it around superiorly or up to kind of reposition all the breast tissue. And that kind of maneuver, which is definitely more of a newer technique, is how you can reshape the breast and actually have a breast mound that looks desirable and youthful. I would say in a high majority of the cases that we do, people come out from the surgeries and they're pretty impressed that they have fullness on top of their breast, right? And that's from all that stuff I do in the OR. So there is some maneuvers we do in the OR, and this is what I was talking about. There's no way to explain it without showing it. So apparently I'm going to have to do it. I've always struggled with this because I want to do an in-OR procedure video, but I think 95% of the people would be totally freaked out.
Yeah.
Because you have, and I'm going to say this delicately, you have the whole breast kind of spread out, and then I put it back together.
Yep.
I had a medical student in one time, and I looked over, and the medical student was so concerned. Like, what is going on in this room? Like, what alien room have they put me in? And at the end of it, the student came up to me. She goes, "That's amazing. That is amazing what you just did." And then she said, there was a time in the middle where I was totally freaked out.
Yeah, if you've never seen one before, especially if you are a female, it could be a little startling. Like stuff's kind of taken apart, and if you don't really understand how it's going to go back together, that could be concerning. Because we do make an incision completely around the areola, but it stays attached to the tissue underneath. So
that's another thing people always say. We've said this before. They always say, I can't believe you took my nipple and areola off,
right, and
set it aside. And I think the joke we made. Well, no, that was the ear.
That was the ear. That was
we have a little couch.
Yep, we put the ear on the couch.
Match box filled with cotton.
Yeah. But I mean, you can see why someone thinks that when you wake up from surgery and there's an incision all the way around even though you know it's going to be there, it still seems in your mind that must have come off and was put back on when in fact it wasn't. So it's almost like you dissect everything, but the nipple and areola is still attached to all the milk ducts and everything underneath and all that fatty tissue. And as Dr. Martin does that rotation and kind of pushes everything back up, it all just goes up together. So we put it in a new place, but it's still attached to everything from underneath.
Yeah.
So it's really, it could be, though, very concerning if you didn't know that, to see that kind of just splayed out there.
So maybe we're not putting that video on our YouTube channel.
Yeah.
We'll do a cartoon.
Oh, I don't know.
With like really cutesy cartoon characters.
I think that might be more disturbing, actually.
That would be, there'd be some weird dude out there be like, oh my God, this is so great. Anyways, yeah, so I think that if you're considering the surgery, you need to go to an office like ours that does all the newer techniques. And, it's really hard to explain those on a podcast, what those techniques are. But definitely, just at its base level, they take the tissue that's on your breast and they rotate it around and up to recreate your breast mound or your breast shape. So it looks like you have an implant in, and you lift the nipple and areola up. The limitations, she was already going there, of a mastopexy or a breast lift is that you could definitely increase fullness above your nipple and areola, but not all the way up like an implant can.
That's not where I was going.
Oh, you weren't?
Not at all. Nope.
Yeah. Where were you going to go?
So I was going to talk about...
Because you had like that sigh, that breath sigh.
Nope. No, I must have just been taking a breath.
What were you going to say?
So the difference, one of the main differences, if you're listening to this and listen to our breast reduction podcast, is with a breast reduction, we're taking kind of like a wedge of tissue and skin out of the breast. With a lift, we're maintaining as much of the tissue as we can and more removing skin.
Yep.
So obviously to tighten that breast, you do have to take some skin out. It's not like we have some magic technique to just push it back up and do nothing else.
Well, they do have the body type breast lift procedure, which... they're as rare as the patient who's actually a candidate for that.
Correct. And that doesn't really do anything anatomical to get you volume back up.
There's some suturing techniques that are newer now that people are using that have a lot of promise. But really, in reality, the lollipop incision with all the work done on the inside is the standard of care at this point. And it has the best outcomes and it's the longest lasting. So you have to accept the fact that you'll have scars. Again, in our office, the scars tend to heal well and it's not a problem. But we understand people's concerns about that.
Yeah, absolutely. Yeah.
Should we go to the next one?
Oh, is it time?
Yeah, I think so. But you already looked.
I did.
You're so bad. Okay, recovery, Amy.
So recovery.
This is your expertise. I basically do the surgeries and then that's where you step in.
That's where I step in. So recovery from a mastopexy alone, so this is a mastopexy or breast lift without an implant, is actually really easy for most women. You do have limitations on lifting and activity for several weeks, but there's not as much pain as I think most people are generally anticipating. Because all we're doing is work on the soft tissue, you have some achiness and incisional pain, but it's nothing compared to having a breast implant.
And why is that?
Because we're just dealing with the soft tissue. We're not placating the muscle. We're not,
So that's another thing. So just with the breast lift, we do not violate your chest muscle or the pectoralis major muscle. That muscle, when you put an implant underneath it, can really hurt. It has a spasm kind of pain, a sharp pain, a muscle pain that is a lot worse to some people than just soft tissue pain.
Absolutely. And it's more... changes more the sensations people feel after surgery. So breast augmentation, whether it's with a lift or not, obviously is kind of changing the plane of that pectoralis muscle if you're having a submuscular implant. So some of that does definitely change the sensations that women feel after surgery. The nice part about no implant is that there isn't any of that, so the recovery tends to be very quick. There is an incision that takes some time to heal, so you do have restrictions from swimming, which we talked about when we talked to Tiffany from afar, and exercise.
Was that one of her questions?
Yeah, swimming, or maybe that was a frequently asked question when we talked about swimming, because you said you didn't think people still swam, and I'm like, people ask me that like on the daily basis. When can
Why did I say
again?
people didn't swim?
I don't know. That was your thing. You're like, who still swims? I'm like, apparently everyone.
Well, I mean, swims. I think maybe in the wintertime, maybe
pools, hot tubs. What's hot tubs? Yeah, people want to get in a hot tub. They want to take a bath.
Tubs, I mean, number one, hot tubs at their baseline are disgusting, right? And then you get surgery, and then you go into a disgusting hot pool of fluid. I mean, are you kidding me?
Hot pool of fluid. Yeah. No, so you really want to make sure your incision is well
are you feeling what I'm saying?
Oh, I agree.
You feel what the rock's been cooking here?
I agree. Okay. Yeah. So, and
I know there's people listening to this. They're like, oh, hot tubs are the best. They're so medicinal. They're like the best thing you could ever do. And like, you can get into a sauna and get the warmth on your skin, right? What would you say about that? Infrared sauna after surgery. When would you let people start that?
Depends on the surgery. So if someone's had a very short incision surgery, like liposuction or something small, as long as all their sutures are out, I would feel comfortable with them being in a dry sauna, not a wet sauna, but a dry sauna. Bigger surgeries like a mastopexy, a facelift, tummy tuck, something where there's a longer incision.
2 weeks.
Yeah, and making sure that really until your scabbing is gone.
Yeah.
Making sure that incision is healed over, there's no scabs, because even if it's dry sauna, you're still going to sweat, and you don't want that bacteria potentially getting into your still healing incision.
Yep.
So one thing that we didn't talk about with the technique of mastopexy that's actually really cool is that there are very few external sutures and sometimes none at all. So there are sometimes no sutures that you can see, which is, I think, really kind of freaks people out because you see this incision line and it's like somehow just magically staying together and closed because of all the internal suturing that you do. So at most, I would say maybe like take out 5 to 10 total sutures at the very,
yeah, because
very
we use
most.
absorbable sutures. Now, when you bring the breast together, at least when I do it, I use permanent sutures that are down deep to hold the breast tissue where it needs to be. But the superficial closure is all absorbable sutures that are gone within 2 months.
Yeah, so
and you don't see them.
Yeah, so recovery is, I think, easier than people might think. The biggest concern, especially for women who still have young children, is going to be a lifting restriction and maybe driving, for a week or so. Other than that, it's not super painful. The incisions they heal well. They're discreet. They're easily hidden with clothing.
Yeah, that's another thing too. If done correctly, you're not going to see it when you wear like even a fairly narrow bikini.
Yeah. You wear a pretty tiny bikini and not see these scars.
So
yeah.
Oh. We kind of flew through that.
We did. I feel like it's because we've talked about it in some ways before, but
yeah.
Yeah.
I think the reason we flew through that kind of quickly really comes down to the fact that it's an awesome surgery that doesn't have a lot of downside to it. I think people's biggest hurdle is the scar formation, and at least in our experience, that scar formation tends to heal, and people are not. They don't have a mental block about that. They're happy with their results. They feel feminine. They feel good, and they're ready to go. Now, the scar does take a while to mature, and that's one thing.
Yeah.
So some people will come in about 2 or 3 months and are like, WTF.
Like I still
It's
have
red.
a scar.
Yeah.
Yeah. And that's part of the process of any scar. And listening to our podcast about scar formation is kind of helpful in that sense to understand like how long it really takes a scar to mature. And it's a continual process. Like as you recover, your scar is continually remodeling and rebuilding itself. So there does come a point for most women in recovery where your scar is at its like reddest, like or most angry, and it's like, oh gosh, is it going to stay like this? And then, a few months later, you forget it even happened.
Yeah,
So
I've only had a few people where it does. So Amy, you claim that you're a woman. Is that correct?
That is correct.
Okay.
I do identify as a woman.
All right. Today.
On my birth certificate, driver's license from birth. Yep.
Got it. Would you do a breast lift?
I technically, quote unquote, need a breast lift. I definitely do.
And you need that because you have a little bit of ptosis.
I have pretty significant ptosis, actually. And it's just genetic. I've had it since I was in my 20s. Would I do it? Yes. I feel like I kind of just need to be at that point where I have the downtime and the recovery. So yeah, I would absolutely do it. I need it.
Right.
Yeah.
I think I would do it.
When you become a woman?
Yeah.
Okay.
No, I'm being serious. I think it's an elegant surgery. The recovery's not bad. It's fairly quick, and it really does solve the problem, and it's long lasting.
Yeah,
That's a
it
good
is.
thing.
Yeah, I mean, you're going to continue to age. Your breasts continue to age, just like a facelift or blepharoplasty. Anything that kind of involves general aging, a tummy tuck may be the only real exception to this rule. Is that you will likely need some revision of it at some point in time if you care.
Yeah.
So 10 years is maybe what you're going to expect out of a breast lift if you want your breast to stay in that same position. Now, if you don't mind that they descend naturally, they're still going to look better than people who didn't have it done. So
right.
It's kind of like a facelift. Like
we used to describe some of these things as like a Snoopy nose, but like Snoopy's not even popular anymore. The kids don't even know who Snoopy is.
The kids don't, but the people listening probably do.
The ones who have saggy
Maybe.
breast?
Yeah, just barely.
Okay. If you don't want a Snoopy nose, only in the drawing when he's looking down, and his nose is you have to see it to understand. If you don't want a Snoopy nose, we can solve that problem. Yeah, I think breast lift is a great surgery. We do it a lot in our office. And truth be told, we do combine it with other procedures. So rare is the time that people do breast lifts alone, but every now and then they do.
Yeah.
Yeah. And it's commonly post-pregnancy. That's where we see it. People that have had kids and breastfeeding and their breast changed. If you have saggy breasts but no breast tissue there, like meaning that you're sagging but not a lot of stuff there, you're going to need to add volume, and that's where we would do a mastopexy augmentation.
Maybe if you want volume. We have patients who like being a size B or whatever they are.
That's few and far between, but most people would add at least a small implant because they want some fullness of their upper pole or above the nipple and areolar complex. So, but it's a great, elegant surgery. It has long lasting. So we're very pleased with it. You can check on our website. We have multiple pictures of a mastopexy and mastopexy augmentation, which is with a breast implant. I think we did it, Aim.
Yeah. Thanks, everyone, for listening. We appreciate the suggestion. So please leave us a comment, rate us, review us. We're on Instagram at Beauty and the Surgeon Podcast. We're also at Jason Martin MD on YouTube and Instagram. And so if you leave comments, like this comment was left like a week ago from when we filmed this. So we do read those. Please
read
comment.
your comments. And just stay away from hot tubs.
Was this a PSA moment?
Yeah. America, stay away from hot tubs. Is that pretty good?
That's pretty good.
All right.
All right. Thanks so much, everyone.
Thanks, guys.